I need to introduce myself again, but I'll just either ways tell you I am Dr. Sonali Luthra Gandhi. I have worked with Dr. Komal Majumdar for a very, very long time. I'm sure everybody knows who Dr. Komal Majumdar is. Besides that, I have my two private practices in Mumbai itself. One is in Ghatkopar and one is in Matunga. So basically, I have got a lot of exposure and I've got a lot of patient exposure because of the multiple clinics that I've been working in, right, ranging from different areas in Mumbai. And that's the reason why I'm able to document and try and do as much as possible with my composites. The most important part of my success is my backbone, that is my family. As you can see, we are a family of 5 dentists. All of us in the family are dentists, and because of them, I'm able to still move forward, remove time for these webinars, and impart my knowledge to whomsoever possible. Okay, so the topic of today is single shade restorations, truth or gimmick. And we are going to cover a lot of topics inside that, introduction and a lot of clinical protocol XYZ. So before wasting any time, I'm going to talk about a little bit about composite resins. We need to know a little bit about composites resins. Now, don't worry, I'm not going to go back to the basics, okay? Not like the material science and all of that, but we definitely need to understand that which composite resin is a good composite resin and which one should we use. I'm sure there's a big confusion in everybody's head regarding the same, because there are so many companies available in the market today, right? From 3M, Tetrick, we have GC, we have Kulza, we have Beautiful, we have Tokoyama. So there's a lot of variety that is available today from us for us to choose. So there's already a huge confusion in this in itself, that which composite should we choose. Now, to top all of that, every company in itself will provide you different types of composites. For example, 3M has a range from 3M Z100 to Z350. Tetrick has Tetrick and Ceram, Ego Ceram. Then we have Charisma Smart, we have Charisma Diamond, we have Charisma Venus. We have a lot of varieties. So again, we do not understand which composite is the best composite or which composite is the right composite. That is the right question. It's not the best composite. As you know that the composite companies that are available maybe really very good, but which is the right composite for your right case? So that is the biggest question. So what do we land up doing usually? How do we land up choosing up a composite? We wait for any MR to enter to our clinic. Okay, then MR will come and tell us, ma'am, today in your market or in your area, this X composite, we are giving you a deal of X amount and you're getting some 4-5 syringes. Everybody in your area is using this and it's going to be the most cost effective for you. And we land up going ahead for the most cheapest option available for us, because we believe that composite dentistry is not a very rewarding field of dentistry. I'm sure everybody agrees with us. For a single class 1 restoration or a class 2 restoration, we are not able to charge as much as we really should according to the amount of efforts that we put in. We are not able to regain that much effort money. So what we'll end up doing is we'll end up buying the most cheapest composite, which will give us good results. But at the same time, we don't realize that it may be not very good for that particular case. So what we need to understand is when we select a composite, we need to understand that it should have good strength. First of all, it should have good strength so that when we are using it in the posterior region, there should not be any fracture, repetitive fracture, and there should not be any, failure of composites. All right. And the second and most important point for us to have in a composite is the polishability, the aesthetics, the luster. This is very, very, very important. If we do not have this component or this important aspect in a composite restoration, then the composite restorations do not land up going on for a very, very long time. The life of the composite then automatically reduces to a lesser amount. So we need to have these two good important qualities in the composite that we are planning to invest in. So how do we know that which is the right choice of composite? Okay. Can somebody, I think somebody is on unmute. Can you just mute yourself, please?
Dr. Sridhar, can you please mute yourself? Dr. Purnima also. Dr. Sridhar, Dr. Sridhar, can you please mute yourself? Ma'am, actually, I've given you the host right, so I'm not able to mute him.
I'll just give me a moment.
Dr. Sridhar and Dr. Purnima. I guess he's not aware he's unmuted. Yeah. Yes.
All right. Okay. Great. Okay. So when we talk about composites, I'm sure we all know that there are a lot of composites like macrofill, then there are microfills, there are hybrids, nanofills, minifills. So as and when, again, composite dentistry is advancing, our products are also advancing. Because there were limitations in the beginning, we have come up with so many types of composites so that today we get the best results. So today when we see in the market, there are 2 or 3 types of composites which are the most commonly used composites and are giving us good results. Okay, so the best composite actually in the market today is a nano hybrid or a nanofill composite, and the second best type, which I would say, is a micro hybrid composite. So now we should concentrate on not the cost effective aspect, but we should concentrate on what type of composite that composite company is selling to you. Is the company selling to you a micro hybrid or something lesser than that? If you buy something anything lesser than that, then naturally you are not going to achieve the results that you are expecting. Okay. So for example, if we are in a posterior region, as you can see, like in this case, this is a premolar area. It's a quite big class 2, which involves a nice proximal wall buildup. So in this, the most important property that we want in a composite is strength, because we are replacing an entire wall. So in such a case, we would prefer to go for at least a micro hybrid composite. At least a micro hybrid composite, so that the composite does not fracture or fail in future because of the composite of the occlusal forces. However, if we are in the anterior zone, wherein not only the strength matters, but even shine, even luster, even durability, even the textures, everything, all of that matters. Like in this case, if you'll observe, it's a 10-year-old child. There is a nice incisal fracture. Okay, you'll see there are a lot of characteristics that we have to repeat. We have to repeat the pericarmita, we have to repeat the luster, we have to repeat the translucency. So this is the pre-op smile, and this is the post-operative picture. Now, in such a scenario, if I only use a micro hybrid composite, then there are chances that the results will not be like this. Okay, then we have to upgrade ourselves to go for a nano hybrid or a nanofill. Now, nano hybrid comparison with micro hybrid, the comparison is the nano hybrid has more polishability, has more luster, is more longer lasting. So if we want results like this, wherein we can replicate almost everything, as you can see, there are surface textures, as you can see, there are lobes, then you must at least go for a nano hybrid or a nanofill, wherein you get good strength also, but at the same time, you are upgrading yourself to a nice shine and luster. So today's market, I would say, what is going on is mostly nano hybrid. But suppose where you are very much in the posterior region and aesthetics is not very important to you or the patient, then you can compromise and go for a micro hybrid. Okay. So at least now we've understood that we should buy a composite not based upon the schemes and the cost, but you should buy a composite depending upon what type of composite is it and what is your agenda to use it. Where do you think it is indicated? If you are in the anterior region or the posterior region, and what exactly is the reason of the composite restoration. All right. Now, whether we are in the posterior region or we are in the anterior region, shade selection or shade matching or getting the perfect shade is something which we all are wanting to achieve. All right. There is nothing like we don't want to match the shade. Even in posteriors, we really would want to match the shade. In anteriors, especially, we would want to match the shade. So this shade selection criteria is extremely, extremely important and is a difficult and a time-consuming process. So had it been that if every patient today that entered our clinic would have the same set of teeth or the same shade, it would be so easy, right? That we would have to just pick up one shade, same shade which is available. For example, A2, which is the universal shade of India. We would just need to use that, and every patient we would have to use that, and our time would get saved and we would be able to give a better result. However, God has made us all differently. Not a single patient, not a single smile is same. And every patient that enters a clinic, like you can see in these 4 cases, every patient is going to be different. Every patient is going to have different characteristics. Every patient is going to have a different shade. Now, as clinicians, we want to give the best to our patients. So if you want to give the best to our patients, to match to the correct shade, to get the perfect color, we need to have a huge inventory. We need to have a shade ranging all the way from A1 to D4, because we never know which kind of patient is going to enter our clinic. And thus our inventory keeps on increasing with time. First we buy some X amount of shades, then we buy some amount of shades, then we buy some Y amount of shades. And sometimes this can also be an expensive affair, especially if you are not too much into composite dentistry. For example, if you have the knack or love for surgical aspect or implant dentistry, you would rather want to invest in an implant kit rather than investing in a composite huge kit, which is also an equally expensive affair sometimes. Along with that, you'll buy brushes, your polishing kit. So it can go above your, above your set limit of money that you have set to spend on or shell out on composites. Now, what if today we were told that you don't need to worry about the shade, just go ahead, relax, pick up this one particular shade, and it is going to blend to all shades available in the market? What if we were told that this one composite is available in the market which matches to all the shades right from A1 to D4, and we have to stop worrying about shade selection? Is this even possible? Have we reached a stage in dentistry today where we are able to use only this one syringe? Coming to the $1 million question of today, that is single shade restoration. Is it possible? Is it a truth or a gimmick? And the answer to this is yes, it is possible. Today, we have such a product available in the market which is going to blend to all shades right from A1 to D4, right, just exactly named as Charisma Diamond 1. This beautiful product from Kulza has made at least my life as a dentist, as a composite or an aesthetic dentist, whatever you would call, much easier, because now my stress of literally doing shade selection has reduced to a greater extent. Okay, so as the name suggests, Charisma Diamond 1. What does 1 suggest? That it is only one syringe. You just need one syringe, no multiple shades, to match or blend to any kind of shade or any tooth in the oral cavity. Wow, like imagine we have reached a dentistry so advanced that we can literally just pick up one syringe and reproduce the results that we want. Now, the good part about this composite is it is a nano hybrid composite. Now, like I said, nano hybrid is the one that we are using in today's world, which is giving us good results in the anterior zone, as you can see here. And it is good in strength also, as you can see in the posterior. So you can use it not only in the posterior, but also in the anterior region. So what will happen is that when you use this composite, you don't have to think twice before picking up this composite, because you are sure that the composite is going to blend. Besides that, fluorescence, which is a very, very important property of the tooth. What is fluorescence? Fluorescence is basically when it glows, or basically it gives up the natural lifelike appearance. If the tooth misses fluorescence, that means it looks non-vital, it looks dead. So this is what happens when we do an anterior or a posterior composite restoration with a single opaque shade, and the fluorescence is missing and the tooth looks lifeless, it looks dead. But with this composite, this fluorescence is maintained exactly and it is matched perfectly to a natural tooth. So if you just use it, it is not going to look dead, it is not going to look artificial, it is not going to look non-vital. One very important property that this composite product possesses is the chameleon effect. Now, as we all know, chameleon means what? Okay, what does a chameleon do? As you can see in this picture, okay, if the chameleon is going to touch a particular object of some particular color, for example, in this picture, it is touching a pink color and a blue or a green color, it automatically blends and adapts itself to gain that particular color. Now, why does the chameleon do that? Why does it really require to blend into the environment, and how come this property is given only to some particular animals or to some particular breeds? It is because they need to protect themselves from the environment so that they do not harm themselves because of other animals around. Also, this property is being given to them so that they can easily get or attack their prey without being noticed. Okay, so this chameleon effect, in short, means basically this chameleon is adapting itself into the adjacent surrounding, no matter whatever color it is, in such a way that it becomes almost invisible. Okay, so this beautiful property is available or is incorporated in this Charisma Diamond 1 product. Now, as you can see, there is an experiment done. There is an A2 shade and there is a C2 shade ring. Okay, so Charisma Diamond 1 product was placed right in the center and light cured. Now, as you can see, they are all seamless. You cannot make out that there is a composite ring which is still placed in the center, which is blending so beautifully. And also you will be able to see in this tooth also, in the cervical region, there is a cervical defect and it is being restored with Charisma Diamond 1 product. So the composite blends to the any shade that is present in the surrounding. Now, not only does it blend in the center, but it has a beautiful color adaptation potential even at the margins. Now, as you can see, the margins are just not visible. So what happens is that not only the composite is getting seamless or getting invisible in the center of the restoration, but even all around at the margins. So we get a good, beautiful restoration which is not visible, which is invisible. So this one amazing property is something which makes this composite almost invisible. So what happened is that they also did one more experiment starting from A1 to D4. So they took different shades of tooth, or you can say typhodont teeth, and they made similar class 1 cavities in all the teeth. And now they restored it with this Charisma Diamond 1 product. Basically, this only one syringe, not different colors, only one syringe, and restored every tooth. Now, as you can see, it is blending to A1 also, it is blending to D2, it is blending to C3 as well as D4. So this material is so versatile that we are sure that no matter wherever we use, you are going to get a good and nice seamless result. But how is it possible? How is it that all this while this was not available and now suddenly we have this product which is available in the market, which is claiming that it can now blend to any shade that is available or any shade of your tooth? Okay, how is it possible? Before I understand, or maybe you understand the science of this composite, we need to understand how do we perceive different colors. Okay, what happens is, how do we perceive a color as yellow, red, green, whatever? Okay, now when you see a regular light, regular spectrum of light, it has 7 to 8 colors. Okay, we have Vibgyor. It is visible light. Okay, but it is called visible light, but actually it is invisible. Okay, so when this light falls onto an object, okay, like in this case, it is a green colored leaf. So when it falls onto an object, rest all the colors that the light has, okay, it will get absorbed. And only color which this product is, like the leaf is green, only that will get reflected and that gets perceived to our eyes. So this is how we now perceive that this particular object is a green colored object. All right. Similarly, in this spectrum of light, okay, when we have a red object, for example, then all the other colors will get absorbed and only red will get reflected, and what we will see is red. However, in this spectrum of light, there is no black or white color. Okay. Now, when it falls on a black color, all the colors get absorbed. So we perceive that object as a black color because no color is now getting reflected and we cannot see any color. So now that object looks as a black color. What happens with white color? How is a white color made? This entire visible light in itself is white color. All colors together make it as white or visible to us. So when it gets reflected or when it gets thrown upon a white object, what happens is all of these colors get reflected back. So what do we now perceive is we see now this object as a white colored object. So this is how the color perception works. If it falls on a green color, it will show you green color. If it falls on a blue color, only blue gets reflected and you see blue color. Okay. However, for black and white, there is a difference. In black, all colors get absorbed and everything looks black to you. However, in white, all colors get reflected because together they form the white range. So then we need to make sure that this particular color is white. Okay. However, in teeth, okay, now when we know that we have A shade, B shade, C shade, D shade. Now, more or less, when we talk about teeth, they are usually in the white range. We have in the white range. But when they are in the A range, you have a little bit more of red or brown color. When we are in the B range, you have more of reddish or yellowish. C is more grayish and D is reddish grayish. So what happens when light falls on these objects and how do we perceive it as A, B, C or D? More or less everything looks white. So when it falls in the A range, okay, the entire light spectrum will get reflected, yes, but the red and the brown color will get reflected more. So what do we perceive it now as the A range? Now, depending on amount of the redness present, you will be able to differentiate the yellowness of the A. If there is more and more red present, more red will get reflected. That is what you will be able to perceive more. And then you will be able to perceive that color as probably A4. And similarly, it goes for B, C, and D. Okay. Now, in the regular composites that are available today, to reproduce these colors, to reproduce A or A1 or A2 or B1 or B2, you have to add these certain pigments. For example, in A1, you will have a very minimal amount of red and a minimal amount of brown. So you have to customize your composite by adding this minimal amount of red and adding this minimal amount of brown and creating an A1 shade. So similarly for B, C, D, we have, or composite companies create these shades by adding these pigments in it in the right amount. All right. And thus we have multiple shades that are available because we have pigments which are available of the right color and we get the desired shade. However, there is no standardization. Now, if I pick up A1 of Kulzar company and I pick up A1 of 3M company, do you think both of them will match? No, they do not match because there is no standardization of how much pigment I am going to add in X company or in Y company. All right. So then there is a big confusion again that which composite company should I take, which is going to match. And naturally, composites are not based on beta shade guide. The composite company in itself has its own shade guide ideally. All right. Many composite companies provide you with a shade guide themselves that this A1 is going to be produced if you use my A1 product. So this is one biggest problem in doing shade selection because we cannot rely completely on a Vita shade guide. Okay, and that's the reason why we have to have customized shade. So this is a very big problem, and that is the reason why shade selection has always been an issue for many dentists even today. I would not say that even I am probably perfect in every case. I may also take a lot of time in certain cases because to get the right or correct shade, it takes a while. Okay, so we have multiple companies, we have multiple shades, but no standardization. We cannot match A2 of every company because it's never going to match. All right. So how is it that this Charisma Diamond one product, without having any added pigments, okay, without having any particular shade, it matches to all the shades that is available because it has this property known as adaptive light matching property. Now, what does this mean? Okay, I know these are very big terms. You don't have to understand. I'm going to simplify it for you. All right. What does it do? Basically, the technology that is introduced in this composite is that the refractive index of these filler particles that are present, they are extremely translucent. Okay. So it is so that when light falls on this particular composite, most of it gets passed through and very less gets reflected. So it is translucent. It is extremely translucent. Now, since it is translucent, for example, there is a ball which is a translucent kind of a ball and it is kept around a yellow or in a yellow box. Okay. So now when light will fall, most of the light is going to pass through. So light will fall, pass through and reach the yellow color. And now only the yellow color gets reflected. And now what you perceive is yellow color. This composite also works like this. Now the refractive index of this composite is so translucent that if you put it in a cavity of a tooth which has A1 surrounding, okay, now what will happen is the light will fall, it will pass through, and now they get reflected by the tooth. Now the tooth is which color? Like I said, A1 color. So what gets reflected back is A1 color, and what you perceive now is A1 color. So this technology now, since it is being introduced in this composite, it basically, because of the high translucency, it reflects the surrounding color rather than the color in itself. Okay. But what about the center or the core where there is nothing that is reflecting? The second and most important good technology that this composite has is that the filler particles in itself, they are customized in such a way that they themselves will reflect red to yellow range. That means if, for example, I take a composite ball of Charisma Diamond 1 and I put it on my hand and I light cure it, what will I see? I will see more or less a tooth colored material only, because these particles are customized to reflect the shade ranging in the tooth colored range. So it will look like tooth color, all right? But at the same time, because of the surrounding, that color also gets reflected and this internal light scattering happens, and eventually the product looks like the tooth which is surrounding the restoration. So what happens is that this composite now adapts itself because of the light scattering effect and because of its high translucency to the surrounding tooth. It's very simple. It's a very simple logic. And because of this, you get good, invisible, seamless results. So as you can see in this diagram, all right, this is the tooth. The yellow part is the tooth. You'll see there are small nanofiller particles and there's some bigger size particles also. Now when light falls onto this restoration, now you'll see the orange arrows, they go They pass through these filler and polymer and get reflected by the tooth surface, and what we perceive is the color of the tooth. However, if they get reflected by the filler particles also, all right, like these blue arrows and the red arrows, don't worry, these filler particles themselves are customized in such a way that they are going to match and create the tooth like appearance, and thus eventually internal light scattering, it will show the shade of the surrounding tooth. So this is how this product works. Now what happens if we use it in thicker areas or thinner areas? If we use it in extremely thin areas, we have good thickness of tooth, which will reflect the color, and we get good enough amount of restoration, which will blend. If we use it in good thickness, then the opacity also increases of this material and chromaticity also increases. So in itself, it will not be very translucent, even though the product is translucent. Okay, so it becomes more and more opaque as and when you increase the thickness of this product. So as you can see, if it is a small restoration, all right, like it's a simple class 1, you place this composite, light will fall, it will get reflected by all the walls, and what you perceive is now the shade of the actual tooth and not the shade of the restoration. However, if you have a larger cavity like a class 2 restoration or a class 1 compound, then what is going to happen when there is no wall present? So wherever the wall is present, the light is going to get reflected from these walls, and you will be able to perceive the exact shade. But what about this area where there is no wall present for it to reflect the light from? What is going to happen? Here, now, this product has its own color. Now, that by internal light scattering is going to get reflected. And now what you perceive is a tooth-colored restoration. Slightly more translucent than this area. That's about it. Not exact shade as your current existing tooth, because there is no wall over here for the light to get reflected. But at the same time, by internal light scattering, and now by here these internal light scattering, this area also blends to the color which is present in this area. Okay, so this is how it works. So what are the advantage of this beautiful product? First and foremost, you're never going to go wrong with the shade, naturally, because if you are working in an A1 or an A2 or an A3, specifically in the posterior, especially if it's a class 1, you just need to place this. Because of this translucency and internal light scattering, it is going to look exactly the same shade. Second property, it is a nano hybrid composite. Like I stated in the beginning, it is a nano hybrid composite, so it has good strength, it has good polish, it has good luster, and at the same time, it is going to last for a very, very long time. One very important property of this product is that it maintains anatomy. By that, I mean, if you will observe, there are many products, when you place them on your tooth that is to be restored, and you give it some anatomy, and you leave it for a while, it will slump. It will probably flow a little, or it will just fall, and it will not maintain the exact anatomy. However, this composite is not like that. It is slightly harder. By that, I don't mean it is hard, but the consistency is such that even though if you keep a nice groove, it will maintain that groove. It will not slump, and you can light cure it and take your own time to create the anatomy that you are wanting to give to the restoration. So all in all, this product will save your time, because you don't have to waste your time too much in doing a shade selection. It will save your cost, because now your inventory from here to reduces to this much, because you're now going to use only one single composite syringe. And of course, since it is a nano hybrid product, you do not compromise on the quality that you are giving to your patients. Okay. So does this mean that this product now can be used in every case, whether it is anterior or posterior? Now, since it is a new product, it has certain limitations. When I talk about using in posterior region, yes, I can use it anywhere in the posterior region. However, as your aesthetic demands will increase, for example, if you're in the anterior region, you're looking for certain translucencies, mamelons, yes, then you cannot only use this product, but you will have to use it in combination with other shades also to give you the perfect aesthetic desired result. So if you are in a posterior class 1 region, be rest assured you can use it without any problem. You will have a great shade matching. You will have great seamless margins. Margins will also not be visible. If you have a class 2 single MOD or an MO or just a DO, again, you're not worried because again, here there will be a contact. So even if the wall is not present here, you will have some amount of translucency, maybe or maybe not. But more or less, it will give you very good results. Small class 5s, don't be worried. Minimal small class 5s, wherein light will reflect to the internal tooth structure and give you the right results. However, if now you're in the anterior zone where you have a class 4 or a big class 3 where both the walls are missing, buccal as well as palatal, bigger class 5s going very deep, more close to the pulpal area, or in bigger class, posteriors where you have a buccal valve involvement where you are worried about the aesthetics, there you may have to go for a added material. Okay, but at the same time, it is not going to be a biggest challenge. So I'm going to talk about these anteriors also. Okay. So what exactly is the clinical protocol that I follow? Whether I use this product or I use any composite product, my clinical protocol remains the same. Okay. So to begin with, any composite restoration has to start with good isolation. All right. Without isolation, I'm sure you are not going to get the desired result, especially in posteriors when you're working in deep class toes, you're working close to the gingival area, you're working close to the sulcus region. So in those areas, isolation is a must. Okay. So what are the different ways of isolation? To begin with, we have cotton roll isolation. I'm sure everybody is using this in their clinic. Cellulose wafers, really a good way of isolating sometimes in the maxillary areas where your salivary gland is present. Suction, where today I don't think none of us can work without using saliva ejectors or suction and assistants. I don't understand how we work in colleges without all of this. Retraction guard to an extent, yes, can achieve isolation. But if you're looking for 100% results, I'm sure all of you also know that rubber dam is the only way to achieve the good and perfect isolation. Now, who believes that this is a fact and who believes this is a myth? It is definitely a fact. It is definitely a fact that if you do rubber dam isolation, your composite dentistry lasts for even better and longer process. Because all of us, sometime or the other, have fallen into this scenario. Okay, have fallen into this scenario where we have a lower mandibular region and we have a lot of saliva suddenly coming, and now we are like wondering what is happening, and we want suction. So to avoid to fall into this situation, we must use a rubber dam isolation. Now, if in case we are not, and we land up in a class 2 region wherein some amount of saliva is dripping, what are we going to do? Internally, we are killing ourselves. We're like, no, please don't go. We just take a 3-way syringe, blow the air, and now we restart the restoration. Not restart. We do not start from etching and bonding. All of us, we just blow air, remove all the excess saliva and start restoring the tooth, right? And then we inform the patient that, see, it is possible that you are going to get some kind of sensitivity or some pain, all right? And if that happens, it is not my fault. It is your tooth which is causing the problem, right? It is never the dentist's fault. It is never the dentist's fault. It is always the patient's fault. It is always the patient who is having a problem in his tooth, but we don't know how to solve it, right? It is never our fault. Okay. So then what do? We blame everything on the patient, right? Just because we believe that it is time consuming. Ma'am, the patient is not going to accept rubber dam at all. Ma'am, how much time can I waste on this rubber dam? and at the same time, it's not giving me great results. So why do I do rubber dam? Why do I waste my time? Now tell me one thing very honestly. Okay. Now, assuming your clinic shuts down at 8 o'clock in the night, assuming, okay, we're just giving it a deadline. And now a new patient walks in at 7:45. All right. And you suddenly have a good gut feeling that, yes, this patient is now going to give me good money. Like this patient is probably going to be a good paying patient, or the treatment of this patient is going to be elaborate. So I'm going to enjoy doing this patient. So patient comes, sits on your dental chair, and now you ask the patient to open his mouth. And what you see is no teeth available. Everything is edentulous. So now what do you see? Wow, I'm getting a case of full mouth implants, lots of money coming in, lots of money coming in. Now tell me one thing very honestly, how much time are you going to spend to convince this patient that he requires full mouth implants? Very frankly. Now if I would be in your place, I will not tell a lie, but I will definitely spend time as much as possible on this patient. I will tell my assistants also, please go wrap up and go. I will shut the clinic and still try and convince this patient for a full mouth implant, because I know that it is going to work. Now, if we all can convince a patient to go through a major surgical procedure, upper, lower, grafting, XYZ, we cannot convince a single patient to go for rubber dam. Why is that so? It's because we ourselves are not convinced. We are not convinced that rubber dam works because we have not been practicing it since day one. If you are not convinced that a root canal will work, how will you convince your patient that a root canal will work? It's the same thing with the rubber dam. If you're not convinced that the rubber dam works, you are not going to be able to convince your patient that a rubber dam works. So convince yourself first, practice, because every procedure requires practice, and start using rubber dam. Trust me, you see a lot of difference in your composite dentistry or your restorative dentistry if you start using rubber dam. So please, from today onwards, we need to do isolation, but not cotton roll isolation or cellulose wafers or dependent on suction. We need to go for rubber dam isolation. Now, once we have achieved rubber dam isolation, our next step is excavation. I do not do excavation before isolation, because once we have achieved isolation, I am sure my cavity or the after caries removal, my restoration will not get contaminated even by saliva. If I have to do indirect pulp capping, direct pulp capping, I am rest assured that even a single drop of saliva will not cause any damage to my restoration. After which you go ahead and do pulp protection if required. Now, there are many materials available in the market, right from GIC to MTA. Now, depending upon the depth of the cavity, you use the right choice of pulp protective material. The next step is your etching and bonding protocol. Now, my usual protocol here is I etch the enamel for 20 seconds. Then I etch the dentine for not more than 10 seconds, because there I am worried about sensitivity about the dentinal tubules. So not more than 10 seconds. Wash thoroughly. Then you dry it with a gauze or use a chip blower to dry it. Now, when you're drying the dentine, you make sure that it is not completely dry. We do not want to see a frosty white appearance. We want to see a moist appearance. We want to see a little bit of a wet appearance in the dentine region, so that now it is ready for your bonding agent. Next, you apply your bonding agent. Again, you air dry. Now, this is a very important point. After you apply your bonding agent, you make sure you remove all the excess bond away from the cavity. When you put a drop of bond inside your cavity and you rub it or you apply it with your applicator tip, you will see there is some amount of pooling of bond in some kind of crevices or areas. Now that should not happen. That also can cause sensitivity and further problems. So it is better to wash off or remove this excess bond by blowing air with a chip blower, and you literally see ripples of bond flowing on top of the tooth. Once this is done and you're sure that the bond has been applied in all areas, you light cure it for 20 seconds properly. So for example, you have a wide cavity. So if you're light curing here and you feel your light is not falling on this area, please light cure again in that area also. So very simple protocol. First, you etch the enamel 20 seconds, dentin for not more than 10 seconds, wash it thoroughly, make sure all the etchant is washed away. You moist dry it, keep the tooth slightly moist dry, do not keep it completely dry, don't make it frosty white. Apply your bonding agent, air dry to remove all the excess bonding agent, and light cure. All right. So my protocol depends upon whether my cavity is deep or shallow. Okay. If I am in a shallow restorative region, for example, I don't feel the need to use even a pulp protective material. Okay. Then I would go for a total etch technique. Now, what does total etch technique mean? Total etch means I am going to etch the enamel as well as the dentin. Okay, so first I start placing my etchant on the enamel, then I place my etchant in the dentin. Of course, I'm timing myself, wash it thoroughly, and then follow the protocol. Or if I'm in a very deep area, for example, I know that the patient may have sensitivity. The patient may already have a layer of GIC, or you already placed some calcium-based product in the pulp region, so that the patient doesn't have sensitivity. Then I would like to go for a selective etch protocol. Now, what is selective etch protocol? I will only etch the enamel. I will not etch the dentin because I am worried that there will be sensitivity. Just give me a moment. 1 minute.
Dr. Rohit, can you please mute yourself? Dr. Rohit? Dr. Meghna, also please mute yourself.
Yeah, sorry for that. Okay, so like I was in the deep areas. Yeah, now when we are in the deeper areas, okay, we are already worried about sensitivity. We are worried that the patient may come back with sensitivity. So then what do we do in such situations? We do not etch the dentin at all. Okay, we only etch the enamel for 20 seconds, wash it and dry it. And now the bond that we will use will be a 7th generation bond. Now this bond in itself has your etchant present. So we don't have to worry about etching the dentin separately. Okay. So if I'm doing a total etch technique where I am etching the enamel as well as dentin, then I will use a 5th generation bond which does not have an etchant present in it. However, if I am going ahead and not etching the dentin, then I would like to go for an all-in-one or a 7th generation bond which has etchant present in it. Okay, so then the etchant along with the bonding action gets completed in the bond itself. Okay, there may be certain cases where you're so worried about the sensitivity, you don't even want to etch the enamel, or if there is severe attrition and the patient is already very sensitive. So what would you like to do in such cases? You can go directly for a 7th generation bond also. You need not only be stuck upon etching. However, my personal preference is to always etch the enamel no matter what, because that is where you get maximum microporosities and maximum micro retention. So if possible, try and etch the enamel at least. However, if you feel no, the sensitivity will be too much, then you can directly go ahead and use a 7th generation bond. Okay. After my etching and bonding protocol, next step, naturally, if it is your regular class 1, then you go ahead and you start layering your composite and you start curing your composite. Very simple. But if it is a class 2, then it is a must to go ahead and use your matrices and wedges. Now, there are various types of matrix bands also available in the market. Now, we have these straight bands like Toffel-Mayer, Ivory number 8, P-band. You have a lot of straight bands which are available in the market. But today, what we have most commonly available is your pre-contoured matrices with a G-ring or a ring which helps to hold these matrices in place. Now, what is the advantage of these pre-contoured matrices over straight bands? Now, as you can see, the shape of these metric bands, they are concave, and they are concave not only from the apical to the cervical region, but also from your buccal to lingual region. So what happens is that when you place it in the required area, it will exactly give you the shape of the proximal wall of a tooth. So you're not worried to reproduce an exact replica, because this will give you a nice desired shape in itself. Okay, so it is available in different sizes and shapes. Now, as you can see, if it's a deep class 2, then you can go ahead and use such a longer extension also. However, if it's a small premolar, then you can go for a small band. If it's a molar, you can go for a bigger band. Okay. So there are a lot of companies that are available, right from Palodent, Garrison, Philadent, Vagotrix, and now you have BioClear also. So whatever you would like to buy and invest in, please go ahead and buy, but avoid using straight bands. Why is that so? Because straight bands will not give you the contour that you're looking for, will not give you the contact that you're looking for. However, these contoured matrices will give you your desired results that you are looking for in a composite restoration. So a good contoured sectional matrix is a must in today's world. Along with this, you need to buy these separator rings also. So whichever kit you buy, yes, you will get these separator rings. Now, why are these separator rings important? Mainly to hold the band in its place. Once you place this metal band, you place the ring. Okay, the ring will hold this band in place, because composite, as you all know, is very, very flimsy, or it is not a very rigid material like amalgam. We cannot condense composite. So wherever you place this composite, it's going to take its shape. So if the band moves, the composite is also going to move, and again, you will not get a tight seal. So it is very important that you stabilize this band with the help of this separator ring, and then now you start placing your composite. Okay. The next step here now is layering. All right. So there are three most commonly used techniques. Yeah, I don't know how to delete these annotations actually on the screen. I don't know who has made these, very frankly. So yeah. So layering techniques. When we talk about posterior teeth layering technique, there are three techniques that we usually follow. Now, why do we do layering to begin with? Okay, layering we do so that the polymerization shrinkage stresses that are incurred upon on the tooth gets reduced. Basically, when composite sets, it shrinks to a certain extent, and that shrinkage can cause the tooth to undergo a lot of stresses. Okay, so it's important that we do this layering so that these stresses are reduced. So beginning with oblique layering. Now, what does oblique layering say? All right, so you have placed your pulp protection material, after which you place the composite in an oblique manner in such a way that it touches only two walls, probably your buccal and pulpal, or your lingual and pulpal, or your mesial and pulpal. Okay, so it touches only two walls. Basically, you're placing it in an oblique manner. So when you're in a deeper cavity, your lower oblique layers will be your dentine shade, and your superficial layer will be your universal shade. Okay, that is your oblique. When it comes to bulk and body, then you have to place a bulk fill composite in the bottom, so that major chunk of it can get used up by your bulk fill. And then on the top layers, you place in your oblique layering, and you build your anatomy. Okay, so I'm going to show you a technique wherein I'm going to show you the cuspal technique along with bulk and body technique. Okay, so this is the tooth. wherein we have first had gone ahead and done isolation, we've done excavation. Now, as you can see, it is a very deep kind of a cavity. We have placed a pulp protective material over here. Now it is deep again, so we go ahead and do selective etching. Okay, thoroughly wash it. Now, since I'm doing selective etching, I'm going to use a 7th generation bond because I do not want the deeper areas to remain unetched. Okay. Then I'm going ahead and placing a flowable composite and a bulk fill. So this now my material, now my cavity depth is now reduced to this much. Now in this much area, I'm going to go ahead and do my restoration. Okay, so now you go ahead and start placing this composite cusp by cusp. Now this is known as the cuspal technique. Here you can also go for oblique layering technique, but here in the cuspal technique also, which I usually prefer, you are again touching only 2 walls at a time. You're touching either the buccal and the pulpal or the mesial and the pulpals. As you will see in this case, you build one cusp, other cusp, third, fourth, and fifth. So the advantage of this technique is you are not only avoiding polymerization shrinkage, but at the same time you're building the required or desired anatomy that you are looking for in this particular case. Okay, so we add a little bit of tints and you go ahead and get the final results. Now, no matter how much ever shade selection we do, you probably still can see the margins that are visible. Okay, so this is the limitation of the regular composite sometimes, that you may do a good restoration, you may get a polished restoration, but still some amount of demarcation may be visible. So when you're using this Charisma Diamond one, you use any layering protocol. You go for either oblique, you go for bulk and body. Of course, you cannot go for bulk and body in this, but you go for oblique or you go for cuspal. You're not worried about the shade selection. You're not worried about the margins that are going to be visible, because this Charisma Diamond one is going to make sure it blends. Okay. Now, when we are in the anterior region, we have multiple stratification techniques. Okay. Our whole life has gone into layering protocols in the anterior region to match to the correct shade. So you have histological layering, you have monoshade layering, monoshade only one shade. Okay. You have natural layering technique wherein you use different shades of dentine in your inner layers and then you go ahead and use enamel shade. You have style Italiano technique wherein you use only dentine and enamel shade, and you have many more techniques. Now, to elaborate on how to use which layering protocol in this Charisma Diamond one case, I'm going to show you and talk about it more in detail as and when I show my cases. Okay, so which technique do I exactly follow? None of these techniques do we follow when we are using this Charisma Diamond one. Our life becomes much more simpler when we are using Charisma Diamond one. So what do we do? How do we do? I'm going to show you in my cases. Okay, so in the anterior region, we cannot only rely on this one particular shade, that is Charisma Diamond one. Yes, that is a limitation. We have to layer. Yes, that is the second thing. But do we have to spend so much time on layering? No. Do we have to spend so much time on shade selection? No. So that you are going to come to know when I talk about my cases. Okay. So next process is your finishing and polishing. So to remove any high points, all right, whether anterior or posterior, whether I remove from the palatal aspect or occlusal surface, I prefer to use these stones or these burrs which are available with shofu. These are the composite finishing kit. Okay, or you should go for a red ring burr. Now, red ring burr is not very coarse as a blue ring burr. So, red ring burr will try to finish the restoration rather than remove a chunk of the composite which has high point. Okay, then in your proximal areas or your surface areas in your anterior region, you go ahead and use discs. Now, discs also directly, you cannot go for using an extra fine disc and assume that you're going to get a good result. No, you have to use the disc in series, starting from the coarse, then medium, then fine, then extra fine. especially in the posteriors. As you can see, if you are scared that if you use a coarse disc, it may cause some indentation, it may cause some problem or a ditch, then you go for a medium disc in the proximal regions, remove all the excess, and then you go ahead and use your fine and extra fine. But you have to follow this kind of what do we say, procedure, or you have to follow this protocol if you're looking for the desired result. Okay, then I've already spoken about this. Then the next step is to start with your finishing process. Now, once you use your burr and discs and all that, you will see some amount of roughness present here and there. So what you can use is rubber cups. Now, these rubber cups are very harsh. Okay, they produce a lot of heat, and at the same time, they land up reducing your composite also. So if you're planning to remove minor high points, you can use these rubber cups with pressure and remove those high points. But if you're planning to use rubber cup as a part of your polishing protocol, then you have to use this in a very gentle pressure. Do not use too much pressure, otherwise you land up removing a lot of composite. Then my next second to-go material is my soft flex spirals. Okay, they are available in two colors, white and purple. So first you use white in nice circular motions from the composite to the tooth. Okay, they are not very harsh, so they will give you a nice luster, a nice polish. So first you use white and then you use purple. You'll already start seeing a nice polish and a luster. Last and not the least, if you want the perfect shine, you want that, glossy appearance, you want to literally see yourself in the restoration, then you have to use a buff. A cotton buff is a must. Okay, make sure it is dry, otherwise your buff will become like this. As you can see, the threads have become all loose and they have opened up. Okay, so what you need to do is you use your cotton buffs in a dry state, nice circular motions, put little pressure nicely from the composite to the tooth and remove all the minor abrasions also that are present and give you a nice glossy appearance. So this is my finishing and polishing protocol. Now I'm going to talk about how to use this product in different cases, whether it's a class 1 or a class 2 or a class 3 and so on and so forth. Okay, so now if I'm using this product in a class 1, how do we go about it? As you can see, there is a cavity present in premolars as well as molars. This is a maxillary molar region area. Go ahead, first step, go ahead and do your isolation. Then you do your excavation, etching. Now, as you can see, the two premolars were very shallow, and even a part of this was shallow. Like you see, if I've excavated this separately and these two separately. So these were shallow. So we went ahead and did total etch protocol here and use a 5th generation bond. However, in the deeper areas, here and here, we have done a selective etch protocol and used a 7th generation bond in that area because we do not want to cause any sensitivity. Okay. Now I like to use the cuspal build-up technique. Now, like I said, any layering protocol is okay, but you have to use only this charisma diamond one. Now, even though it is deep, even though, there may be chances that I might have to use a dentine shade and then a universal shade, none of that sort. Just pick up this charisma diamond one and start doing your layering. So we've done a few cuspal build-up like the buckle cusps, and then you go ahead, finish up the build-up, and as you can see, the nice anatomy that is maintained, the grooves pattern that is maintained with this product. This is just after pre-polish. So can you see how this product is blending onto the tooth surface very well? Your margins are also seamless. Now, as you can see, this is a big area which was not restored. A very big area. Okay. But after the restoration also, this product looks invisible. It looks seamless. And this is after polishing. So because of the translucency of this product, because of the internal light scattering, whether you are in a shallow cavity or in a deep cavity, the restoration looks more or less invisible. Okay, this is the image finally. Now, how would you go about in a class 2? Do you think that it will blend or it will not blend? Let's have a look. Now this is a premolar and molar region. Okay, as you can see, the distal aspect of the premolar has a cavity which is visible, but the wall is still intact. So we go ahead and do the isolation. We go ahead and do the excavation. Okay, this is a little better picture. You do your etching. This is a total etch. So I'm using a 5th generation. Now we build up the adjacent tooth because that is a very small cavity. Then you go ahead and place your matrix system, your wedge, your band, your ring. As you can see, everything is placed. Okay. Now only we go ahead and do our layering. Now here also I have followed the cuspal layering protocol. Okay. Like I said, I like to do cuspal layering protocol. That is my to-go technique. Yours can be something else. But my shade matching, as you can see, none of this I have done any particular shade selection as such. I've only picked up this Charisma Diamond one and placed it in the cavity. Now, can you see the results? Beautiful. See the beautiful microanatomy, see the walls, see the margins, nothing is visible. So in a class 2 also, you can go ahead and do this restoration without worrying about the shade matching or without worrying about whether this composite will blend or not. Yes, it will definitely blend. When it comes to class 3s, especially if there are both the walls missing, you are slightly in a dilemma whether I can use this product directly or not. Okay. If your palatal wall is intact, yes, you can use this product directly on top and your shade will match because now your light will reflect from the palatal wall. Okay. So light falls onto the composite restoration, passes, reflects the palatal surface, and what you can now see is the color of the palatal wall. Okay, but if you have a through and through restoration, what happens is, now this is an experiment which was done by Dr. Janine, and she realized that if we only use this product, now as you can see on the medial and distal aspect, 2 different protocols have been followed. So if you only use this product, you see a big translucency. So how do we go ahead and minimize this kind of limitation? Or how do we go ahead and make sure this translucency is not seen? So what you do is, now you used either a dentine shade first to build your palatal wall or an opaque shade first. Now that can be any shade that you want. So for example, in this case, it looks like it is an A3 dentine shade, for example. So first we place an A3 dentine shade in the palatal surface, and now I just layer it with Charisma Diamond 1. So now what will get reflected here is, when I pass on light, the light will pass through the one shade, reflect through the opaque dentine shade that we have selected. That can be A2, A3, whatever, depending upon the tooth. And now what we perceive the tooth as is the dentine shade that we have chosen as. Okay. So here we can overcome the limitation of this product by using only one more added shade, that is dentine shade. However, you still do not have to keep multiple enamel shades. You do not have to keep multiple body shades or universal shades. All that you need to have in your clinic are certain dentine shades and your Charisma Diamond 1, and you can go ahead and do your anterior restorations also. Okay, so I'll show you a case in which we did the same kind of experiment in the patient's mouth. Okay, we went ahead and done the isolation. So as you can see in the mesial aspect, we use the dentine. There we've used A2 dentine and we've used Charisma Diamond 1. So what you see is the good restoration, seamless restoration. However, in the distal aspect, we only used Charisma Diamond 1 because I thought that probably, chalo, it may just blend. No, it did not. It looked very, very translucent. So when you are more in the aesthetic zone, you will have to use an added dentine product, any shade that is, depending upon whatever tooth it is, but you will have to use a dentine and then go ahead and layer it with your Diamond 1 shade. Okay. Now you can see this class 4 and a diastema. So we have a patient, young patient, who's getting married very soon, and he needs to go ahead and finish closing his gaps and do incisal build-ups. He comes to me and says that I don't have time for ortho, I don't have time for veneers, nothing today itself, I need to finish my procedure. Okay, no problem. So this is the pre-op scenario. Again, close up view. So first and foremost, you go ahead and do your isolation. You go ahead and give your bevels. Naturally, that is what is very important for retention. You go ahead and do a total edge protocol. Total edge protocol is a must in anteriors so that you get maximum retention and you do not have to worry about fracturing of the composites. You go ahead and place your bond. Here we are going to use a 5th generation bond. Now, what do we do? As we did not have time for mock-ups and everything, we are building up palatal shells. Okay, as you can see, first I have built up a bigger palatal shell of one tooth because I'm trying to close the diastema also. However, of the adjacent tooth, only the incisal aspect palatal shell I have created. Now, in a usual scenario, when we are doing usual layering, we would have to choose an enamel shade for this. However, in this case, I'm not using an enamel shade. I'm just using this opaque dentin shade, or you go ahead and use your diamond 1 shade. I would suggest to go ahead and use an opaque dentin shade for your palatal shell, because now you will have to rely on this shade for light to get reflective and for you to perceive this color. Okay, so use an opaque shade, then you layer it again with more dentin shade, whatever the desired shade is. Like in this, it is an A1. Okay, so we place dentin shade, light cure it, and now layer it completely with diamond 1 product without thinking about anything. So your final shade layer need not be your universal shade or enamel shade and thinking whether it will blend, it will be translucent. Don't worry. Just place your Charisma diamond 1 blindly, flush it to the tooth, and similarly now finish the adjacent tooth. First you place your opaque shade or dentin shade, whatever is your desired shade, and now place your Charisma diamond 1 directly, close the diastema, and this is the final result. I would say you got beautiful results with this composite without having to worry about shade selection as much. Now, had this been a regular composite build-up case and I wouldn't have this Charisma diamond 1, I would be probably using 3 shades. I would be using dentin shade, universal as well as enamel, and the thickness of each also would have mattered. However, over here, I'm not worried too much about the thickness because this product is so wonderful and so amazing in adapting itself to the surroundings that it gives such brilliant results. Can you see the polishability? Can you see the nice margins, nice line angles we've been able to achieve, and we've been able to give a good aesthetic result to this patient without wasting too much time. So this is the final smile. So it's not like you cannot use this product in the anterior. Despite its limitations, you can go ahead, do some jugaad and go ahead and use this product, reduce your inventory and go ahead and finish your restoration. When you have a class 5, how do you manage it? Yes, like I said, if you have shallow class 5 cavities, directly go ahead and use your diamond 1 product. You're not going to have any problems, no translucency, it will blend. But if you're in deeper class 5 cavities like this, where you have a lot of dentin exposure, so if you directly place Charisma diamond 1, you're going to see a translucent restoration. So what do we do here again? Here first we use an opaque shade or a dentin shade, and then you go ahead and layer it with your Charisma diamond 1. Okay, so I'm going to show you a few more cases. Okay, simple class 1 of your molars. So go ahead and premolar, you go ahead excavation, isolation, etching protocol. As you can see, total etch in some, selective etch in some. Where there is total etch, you use 5th generation. Where there is selective etch, you will do 7th generation. You finish your build-ups, and this is your final. I'm sorry for this photography. My mirror was not very great. However, as you can observe, the margins are seamless. The restoration is flawless. The anatomy is maintained. Another case of class 1 restoration, lower molar. Anatomy is maintained. Restoration is flawless. Now, class 3 composites. Now, this was a through and through restoration. Now, we had already learned with the previous mistake, cannot directly use this composite. So, we go ahead, See the close-up view, choose the dentine, right dentine shade, take the right dentine shade and the diamond one, and you finish the restoration. Now see the beautiful polish that you get with this kind of product. It's a nano hybrid. So you're not worried about the polishability. You get a beautiful polish if you follow the right protocol. Okay. Now diastema closures. Now, can we use this product directly in diastema closures? Again, it's a question mark. Now, like I said, in bigger cavities or in areas where there's nothing to reflect, there is a possibility that this product will look very, very, very translucent. Yes, it looks translucent. It looks gray. So how do we use it in diastemas? Like I showed you in that case, in my previous case, we did a diastema as well as incising. Use an opaque dentine shade and use a diamond one product. However, if you're not in a very aesthetically demanding situation, like in this case, we are closing lower anterior diastemas. The diastema is very minimal. Okay, see this, very minimal. Now, in this case, I can directly go ahead and use the Charisma Diamond one. Yes, I am not saying that translucency is not visible. Yes, it is visible. But when the patient smiles, now this is a formal smile, but when you see the pre-op smile, the patient's lower anteriors are hardly going to be visible. So if I use directly this product, is it going to really matter? No, it is not. Yes, there is minor translucency. I'm not denying that. But when the aesthetic demands are lesser, then you can go ahead and use this product directly. Because you are going to get the shine, you are going to get the polish, you are more or less going to get the right shade also. Okay. But it may be slightly more translucent. That's it. See a close-up view. You can barely make out that this area has been built up with composite. Okay. Some maxillary restorations. Same molars. Beautiful anatomy. No slumping. Nice flush in the margins. Again, lower last molar. Beautiful anatomy. See this minor anatomy also which is being maintained. Okay. Again, lower molars. Maintained anatomy. Again, lower molars, beautiful flush, beautiful anatomy, beautiful shade. So basically, the entire process of shade selection gets eliminated for the time being, at least in your posterior regions. Okay, so is it a paradigm shift? Yes. With the advances in dentistry, with the advancements that have been coming in the technology, we have so much more coming. Definitely, this is a paradigm shift. It definitely reduces our time. It definitely makes sure that a dentist is now easily able to reproduce. Not only an experienced dentist or a skilled dentist needs to be doing a composite restoration, even a fresher can use this composite and blend to the tooth. Yes, of course, certain knowledge is required. I'm not denying that. But at least the process of process of shade selection altogether completely gets reduced. Not eliminated, but reduced. But we cannot eliminate the fact that in anteriors, yes, we may have to still go for layering because we are looking for that high aesthetics, we are looking for incisal translucencies, we are looking for mamelons. So in those cases, yes, we will have to go for layering. We may have to go for more than 2 shades probably. But if it's a simple straightforward case when there is no translucency, just use your dentine and a diamond one, you'll get beautiful results. Okay, so as correctly said by Winston Churchill, to improve is to change, to be perfect is to change often. Now that's how restorative dentistry has progressed. Initially, we used to use only silver amalgams. Only silver amalgams were used to do your fillings and restoration. Then came composites. There were composite fillings that were done. Now we have turned our fillings into biomimetic restorations, that is doing, good restorative dentistry. You restore the tooth in form, function, aesthetics. So we are constantly changing and upgrading ourselves to give beautiful results to the patients. And this beautiful one more change that we have to accept today is the Charisma Diamond one. Let's embrace this change. Let's make our lives easier by using this product along with following biomimetic dentistry. We do not have to eliminate biomimetic dentistry, but by reducing our inventory, because you don't know that you are going to give these beautiful smiles to the patients with this added accepted change also, because the future can hold anything for us. For all you know, tomorrow, even in interiors, I may not have to do any shade selection. Nothing. Just a single shade and probably my results will be perfect. Okay. So let's embrace this change and let's use this beautiful